Well, the Health Department, in collaboration with the World Health Organization, the WHO, will today convene a high-level universal health coverage seminar. The problem is this going to be just a talk shop? Well, the idea is the seminar is part of the International Universal Health Coverage Day. It's aimed at building resilient health systems, and of course, the knock-on effect is a good one. It's meant to create healthier nations. So let's find out where we are on this, and joined by Dr Aquina Thulare, technical specialist at the Health Department. Dr Thulare, good morning to you. I appreciate your time so early on a Monday. Universal healthcare, can we just take a step back before we talk about the seminar? Why is universal healthcare so important, and specifically for South Africa?
Good morning, Gareth, and good morning to the viewers of eNCA. Universal health coverage is a very, very important, pertinent goal that is part of our sustainable development goals as set out by the United Nations with the aim of achieving universal health coverage by 2030. As we gradually recover from the devastating impacts of COVID-19 pandemic, which severely impacted the lives and livelihoods of many people, disrupted essential health services, and reversed hard-earned gains, we are now trying to recover and rebuild as we move towards 2030 through a universal health coverage. What we also want to say, Gareth, is that the pandemic has shown that not investing in strong and resilient health systems for universal health coverage and health security can cost dearly to all our economies and society at large. Therefore, the case for universal health coverage is clear. It is the key to coping with the interlocking health, economic, and humanitarian crisis that our world is currently facing. And what we want to ensure is that everyone in society has got coverage in terms of the quality of health services that the health system delivers, that no one is exposed to financial hardships when they have to access healthcare services, but importantly, that we do not leave anyone behind, whether it's someone in the urban area, in the most deep rural communities of our country, whether you are rich or you are poor, you have to have this coverage in terms of the quality of healthcare services, and that you do not have to be exposed to those hardships financially when you need to access this healthcare.
Dr. Thulare, the problem is, let me come in, and I suppose this is where the obvious question, I'm sure from many people watching right now are going to ask, we're unable to put and sustain a good public health care system. I'm sure you, more than anyone, is very aware of the criticisms of the quality of health care in our public service currently. Why would national health coverage or universal health coverage be any better? What are the systems in place to improve on the public health care system? Where's the money coming from? Where are the experts? Where are the doctors coming from to make it better than our public health care system in our country?
If I may just say that, when we look at the health system and we look at the National Health Act and all the other legislative and policy imperatives that we have outlined, the health system should not be divided into public and public. It should be one health system for one country, South Africa. The challenges that the public healthcare system are facing currently are because of many, many reasons. One of the reasons is that the funding of the public health system is really, really very, very compromised. If you look at per capita spending in the country, you will note that expenditure in the private sector, it's more than 5 times what is spent in the public sector. And then that results automatically in resources such as human resources gravitating closer to where the money is. And that's why you see our healthcare professionals migrating to the private health system and therefore depriving the public health system of the requisite resources that must serve 85% of the population, a population that normally is from underprivileged backgrounds has got a high burden of disease. And therefore, if we do not address this inequitable distribution of human resources, then we are not going to make ourselves use one health system for all South Africa. That is what we meant when we say universal,
Absolutely.
where we leave no one behind.
Dr. Thulare, let me ask you this in closing, very briefly, if you could, just on this seminar. So the seminar starts today. I know that you're going to be involved in this as well. In your mind, as a technical expert in the Department of Health, when do you imagine universal health care being available in South Africa? Just briefly, give me a timeline, give me a marker that we can aim at here.
We have outlined, the roadmap towards moving towards universal health coverage. Of course, universal health coverage is a goal, it's a journey that we aspire for, and we have set ourselves that by 2030, the whole country should be enjoying what we call universal health coverage. For the National Health Insurance, which is our vehicle towards universal health coverage, we have set out some milestones, including looking at the current legislative process, establishing the infrastructure and institutional arrangements that are going to enable us to implement national health insurance, which is going to be somewhere towards 2027. But we are hopeful that, with all the preparatory work and strengthening of the health system, addressing quality challenges in our health system, addressing human resource challenges, we will achieve this goal.
Universal Health, only a pleasure. Universal Health Coverage Seminar getting underway today. There's still going to be a lot to talk about as the seminar continues over the next few days as well. Dr. Aquina Thulare, Technical Specialist at the Health Department. 2030, is that an achievable goal? Universal Health Coverage, of course, is globally renowned. Can it work in this country? And then immediately you're going to have those who are going to start asking questions. Where does the private sector fit into all of this? And this is why the seminar is taking place, hopefully to get some of those answers.